Welcome once again to Take 5, an inventory series, where we earn your trust by providing you the best healthcare supply chain news and advice every week. I'm Alex Diamond, and today I conclude my interview series with Michael Prokopis of Steward Healthcare by finding out how building relationships between supply chain and clinical staff leads to innovation.
At Steward, the supply chain has a relatively strong status, and we're respected for the value add that we provide across the organization. And we've worked hard to earn that. And every time there is a system-wide opportunity, it's about delivering good results, and then that's what gains you the credibility and the cachet to do the next one. But at the same time, there's still always the clinical struggle, which is, a physician has a preference and how do you manage around those preferences? And so, we have to gain champions, and we have to prove every single, time in some of those instances, because there are new audiences that we can continue to demonstrate that we're going to add value and that we really do have patient and clinical outcome in our minds is the most important part of what we're trying to do. And it's not just all about the cost. There are certain things at Steward that allow us probably to have a higher adoption, specifically around standardization, because we're physician owned, and so in some instances it's easy to go to that physician group and to help drive some of the changes that you want to make. Now, again, physician preference items and clinical items can still be quite a struggle, and so standardization is kind of a long, slogging process. It's not you flip a switch and it's done. It's you literally take on each initiative one by one, and I'll call it guerrilla warfare that you have to perform or execute in order to accomplish the goal, which is to standardize or to conform to whatever the event calls for. So it starts, and we fundamentally believe that the grassroots efforts is where most of the initiatives and ideas should come from. Clinicians are on the ground. They see things, they know things. They interact with products in a way that we never would at the supply chain level from a corporate perspective. So each hospital stands up its own value analysis meeting. They meet monthly, and they evaluate any number of different ideas and concepts and products. We then take it one step further, and we say at the point in time that facility says, yeah, we want this, they bring it to corporate, and we take a look at it kind of at a system IDN level to say, is this something that should be made available to the entire system? Should we standardize on it or otherwise? And when we're doing that, we specifically go out and look at benchmarking pricing as well as medical evidence to see if there are alternatives or other products already in our portfolio that would satisfy the request. And so depending on the outcome of that, it defines what the next steps are. In the event that we say we're going to adopt it and we want to adopt it broadly, we'll then take it to product category value analysis teams, which are made up of regional representatives, subject matter experts from all the facilities and all the regions. And we'll have a conversation with them about the product and what the next steps are, whether they're going to allow them to demo it or pilot it or bring reps in from the company to teach them how to use it or whatever it happens to be. And they'll help us define what that implementation plan looks like. So we try to seek input from clinicians from all levels of the analysis that we're performing. And we're looking at it both from a kind of an ROI. So, how does finance think about it, as well as what's the clinical evidence that supports it, kind of how the way a clinician might think about it. And by putting those two things together, we believe we're ending up with really solid outcomes that people can actually stand behind and put some energy into accomplishing. So I think that, yes, at Steward, we have really good credibility, but it's because we've earned it, and we'll have to continue to earn it. But we also know that there's still a lot of struggles out there, specifically around physician preference and clinical items.
That's all the time we have for this week. Join us next time as we return to the issues of the day and look forward to a special episode about our 50 for 50 program, which you can learn all about at z5inventory.com, where you'll also find all of our sources and resources for this episode and more, because Take 5 is a production of Z5 Inventory. That's the letter Z, number 5, and the word inventory.com.